So, the recent study really throws a spotlight on how gum disease might be impacting our brains.
Indeed.
They looked at white matter hyperintensities, which are those markers of small vessel disease in the brain, and found that people with gum problems had a higher volume of these lesions.
That's pretty fascinating, right? But what exactly did the numbers show again?
Well, the research involving over 1,000 adults showed that individuals with gum disease averaged about 2.83% white matter damage compared to 2.52% in those without.
Yeah, exactly.
More notably, there was a 56% greater chance of severe white matter damage among the gum disease group.
Wow, 56% is quite significant. So essentially, persistent oral inflammation might be affecting brain health too.
Exactly. It's like the inflammation in the mouth could be spreading systemically, possibly worsening brain conditions like small vessel disease, which is linked to strokes and even cognitive decline.
I see. That seems concerning, but aren't we overlooking some of the shared risk factors here? I mean, couldn't other systemic issues be driving both the gum disease and the brain damage?
Absolutely. That's a fair point. The study does admit that it doesn't establish a direct cause and effect link. It's possible that factors like overall poor vascular health could be contributing to both problems, but it still raises an interesting possibility. Improving oral hygiene might benefit not just our teeth, but also our brain's white matter.
Right, so maybe taking better care of our gums could be like an added bonus, protecting our brain too?
Exactly. Suvik Sen from the study even pointed out that gum disease is preventable and treatable. If further research backs up this connection, then targeting oral inflammation might offer a novel way to reduce cerebral small vessel disease risks.
It's kind of like making sure the foundation of your house is solid so the rest stays intact, right?
Yes, that's a pretty good analogy. It's like ensuring the base is stable to prevent issues later on. And if you think about it, almost half of US adults suffer from some form of gum disease, which makes these findings even more relevant.
Absolutely. So there's both an individual health takeaway and a public health implication.
Definitely. It suggests that routine dental care might have broader systemic benefits than we traditionally considered. It's an intriguing frontier, especially since chronic inflammation is known to play a role in many health issues.
You know, while it's all very promising, I still wonder if the relationship might be a bit oversimplified at times. Could it just be correlation rather than causation?
That's a valid critique. The study itself stresses that these findings aren't conclusive, and more research is needed to fully untangle the connections. But it does emphasize the potential rewards of taking oral health seriously.
True, and sometimes our everyday habits can have unexpected ripple effects. It makes you think twice about skipping that dental appointment, huh?
Exactly. And it's a reminder that our bodies are intricately linked. Poor health in one area might just trigger problems elsewhere. So maybe brushing a little more mindfully isn't such a trivial act
Yep,
after all.
indeed.